Right, so welcome to this series on muscle anatomy question. And so let's get right into the question we have for today. A 12-year-old boy is brought to the ER after falling out of a tree, and X-ray confirmed a fracture of the medial epicondyle of the humerus. On physical examination, the patient has weakness in the wrist flexion. When asked to flex his wrist against resistance, the hand deviates, tilts to the radial side. What muscle is paralyzed? So we have some quiet muscles here. We have the flexor carpi radialis, flexor carpi ulnaris, palmaris longus, extensor carpi ulnaris. So what will be the answer? Let's look at it. Right, so it's a 12-year-old boy is brought to the ER. So he says he has a fracture on the medial epicondyle. The medial epicondyle is this bony bump in your elbow, right? This bony bump, right? So a fracture of the medial epicondyle, meaning that there's a nerve that's going to be affected, and that nerve is the ulnar nerve, right? And the ulnar nerve supplies a muscle. But this is it here. When you flex your arm, there are two muscles that are acting. One muscle tilts your hand to the radial side, and the other muscle tilts your hand to the ulnar side. So it's a kind of a balance. Okay, so it means that one muscle is affected and the other one is not affected. That is why the one that is not affected is still tilting the hand to the radial side, but the one that is affected is not working. So it means the arm is not balanced, it's just tilting to the radial side. So first of all, using the nerve that is supplying these muscles, we can eliminate the answers. So first of all, flexor carpi ulnaris is actually what supplies the flexor carpi ulnaris is your medial nerve. And also the reason why the hand is tilting to the radial side is because the flexor carpi radialis is still intact. The flexor carpi ulnaris is actually supplied by the ulnar nerve, right? The palmaris longus is supplied by the medial nerve. The extensor carpi ulnaris is supplied by the posterior interosseous branch of the radial nerve, right? So the answer is actually your flexor carpi ulnaris. So flexor carpi ulnaris is the answer to the question, right? Yeah, so that's the answer for this question. It's quite basic, it's quite simple. Yeah, it's quite basic and quite very simple. Right, so yeah, that's the answer for today. Thank you.